I've represented the Department of Family and Children Services for about a decade before. Private practice, I've done a little bit of everything, but this by all measures has been the most rewarding work I've ever done. One of the most interesting things we've been doing lately, thanks to, I don't know if I should really be thanking you, Joe, but it's your fault, is we've been for the last year one of the 4 sites in the nation that's been working through the Robert F. Kennedy Children Action Corps, doing a study to try to develop best practices and model systems for hopefully other communities with our dually involved kids. So that means that they come to the court and they already they've had DJJ and DFACS involved. When we started looking at the numbers, anybody have a guess of what percentage of my kids fit that definition? 56%. So, in part of doing this work, what we've realized is that, and we all know that child abuse and neglect are very strong indicators for future juvenile justice involvement. So there is such a high correlation. And the more interesting thing is these kids, guess the kind of offenses they're committing most often? Status offenses, okay? Which is just like that real indicator of, truancy, educational neglect, runaway. There's something not going on good in that house, right? But next thing you know, they're a juvenile delinquent, and that's how they often start through the process. So what we've been doing is, all of you know local interagency planning teams required by statute, where all the different players in the community, DJJ, school board, DFACS, the court, mental health, public health, everybody comes to the table to see how do we address the problem. It was originally designed in the system of care framework to be for severely emotionally disturbed children. What we've done through this process is we're using that existing model because it works. And it gives us the earliest opportunity for a collaborative community look at how we support this family. The family has to be involved, the family drives it. We've developed a community care plan, and everybody leaves that meeting with who's doing what and when are they doing it. We're not telling the family what they're going to do, we're helping understand how to help them. And so we just really started that process. We've developed all the structure around it. But I think as we move to the new code and the CHINS kids, the children in need of services, I mean, think about it. What's that population? Status offense kids, right? So we kind of feel like we've got a year head start on how we're going to be staffing those kids and involving all the resources at the earliest possible time to help the family not get any further into any of these systems. So we're really excited about it. We're having fun doing it, and we've got great partners. So come to Newton County, see us do it.
Joe Vignati, I'm the administrator for the Justice Division in the Governor's Office for Children and Families. I've been doing this work for 26 years in some form or fashion. I've worked in juvenile court, I've worked in juvenile detention centers, I've worked for the Department of Juvenile Justice, expediting kids out of placements, into placements, and then I've been with the Governor's Office for the last 13 years doing juvenile justice grants. So I'm really excited because we have new legislation that really is pushing our state forward. And we're here to talk about community and community-based services and the new code. So that's kind of what I focused my remarks on, or are we just introducing ourselves?
No, I would like you to introduce yourselves with your background, which is exactly, you've got an A+ on that part.
Okay.
And then the next thing is sort of a 5-minute summary of what your agency is
then
doing.
I'm right on board.
In regards to
Okay.
juvenile code.
Okay.
And I'll try not to interrupt.
No. I needed that help.
I'll interrupt you later. I'm sorry I'm a little scattered, you guys. It's,
I needed the help. Okay, so we're here to talk about community. And for me, let's do a quick informal survey, okay? You just have to raise your hands or not. You don't have to get up, you don't have to jump, you don't have to say anything, all right? So out of everybody here, how many of you think that children are best served in their local community as opposed to an out-of-home placement? Show of hands. Okay, great. Don't let your hands down. Wait, hold on. It won't be long, I promise. Okay. Good. This is good. Second question for you. How many of you think that juveniles before the court are best served in their local community as opposed to an out-of-home placement? If you think that, keep your hand up. If you don't, no judgment, or you don't know, you can drop your hand. It's okay. All right. Good. Good. See a lot of friends. Final question. I know your arms are getting tired here. How many of you think that your local communities believe that juveniles before the court are best served in the community? That is our challenge. That's exactly our challenge. Okay. That is our challenge because we have to implement this new law and educate the public about the benefits of community-based approach. So I'm going to give you, how much time I have left? 2 minutes?
Yeah.
I'm going to give you 2 minutes, the thumbnail sketch of all the work that's happened over the last 6 years, real quick. And I'm going to sit down and refer to my notes so I don't leave anything out. The Special Counsel on Criminal Justice Reform has been meeting the last 2 years, and they've made recommendations about both our adult system and our juvenile system to make improvements. And I urge you to go to the governor's website. It's gov.georgia.gov and take a look at the Special Counsel's latest report in December of last year on the juvenile system. But I'm going to sum it up for you in one sentence. Georgia's juvenile system, high cost, low return. 65% of all kids that go to the YDC, the youth prison, recidivate within 3 years. Secure confinement costs the state $91,000 a year for one youth. We have thousands of kids each year that go to secure confinement. 39% of the youth in those secure facilities, 39% are low risk, meaning they're kids that probably would be better served in the community if we made that happen. So that kind of tells you where we are right now as a state and what led to 2 landmark legislative bills that were passed this past session. Very important. Number 1, you all heard about the Children's Code, HB 242, which has been passed, signed by Governor Deal, and it takes effect January 1 of 2014. A couple of highlights with that are prohibiting status offenders and certain misdemeanors from being committed to residential facilities. Establishing a voluntary fiscal incentive grant program that I'll talk about in a second. Focusing our resources, our scarce resources, on proven programs that reduce recidivism and tracking whether or not our juvenile justice programs are actually effective. That's number 1. And then the second piece of legislation, HB 349, which is just as important in my mind, it established for the next 5 years the Georgia Council for Criminal Justice Reform. And the council is, and this law takes effect July 1, is tasked for establishing performance measures to track the implementation of both adult and juvenile reform. And they also shall propose additional reforms to further the reduction of recidivism, lowering state expenses, and to make sure that we have an effective, efficient code that promotes public safety. So at the heart of both pieces of legislation is kind of a shift for our state. And it's a developmental approach to juvenile justice. And this developmental approach focuses on 3 things: holding youth accountable for their actions, preventing further offending, and treating youth fairly. So we kind of paradigm shift for our state, and now we support, through the code and through this reform effort, the positive development of youth, thereby protecting public safety. So I promised, I probably only have 60 seconds left, to talk a little bit about the voluntary fiscal grant incentive program.
It's the opposite of a New York minute.
I get going here. I've been waiting 26 years.
He has.
There's $6 million currently available for local counties, local juvenile courts, to implement these reforms. There are 2 state agencies that are involved with this. Governor's Office for Children and Families. We have $1 million in federal juvenile monies available for courts. And then the Criminal Justice Coordinating Council has $5 million in newly appropriated state funds. We have 2 RFPs because we can't commingle the funds due to the fund sources. But the RFPs are identical. So courts can apply, and actually the due date is tomorrow for the courts. They were released back in
So
April.
you need to leave right now.
They were released back in April, so we've had a good couple of months for folks. We've done a lot of support and outreach with courts, a lot of technical assistance across the state, and we're real excited to see these grants come in. Courts can apply for either or both opportunity, although we will only award one award for a county that's successful. The intent of, I'm getting there.
I know what you're going to say.
The intent is to provide funding for community-focused, evidence-based services to reduce the unnecessary out-of-home placement of youth that are better served in the community. So that's kind of where we are. You know as much as I do after 26 years. So thanks for your patience.
I am so glad that Joe went before me because that makes my job so easy. I too, my name is Heather McDaniel. I am also with the Governor's Office for Children and Families, and I am Joe's counterpart for the Youth Development Division at GOCF. So he did a great job explaining what our agency has done with the new juvenile code and community-based services, but I'm excited to be here representing kind of a different portion, which would be more of the prevention portion. So working with after-school and youth development programs across the state for both just a preventative tool from youth becoming involved in the juvenile justice system, but then also with what Shauna mentioned earlier and Joe, a provision in the new code called CHINS, Children in Need of Services. So using after-school and youth development programs as an opportunity to serve youth in the community and prevent them from further time in the juvenile justice system. So mine's really quick because Joe did such a great overview of that, and I think I touched on what I was supposed to. So I'll hand it over.
Good afternoon. My name is Diana Aspinwall. I'm with the Department of Juvenile Justice. A little bit about my background. I've grown up in this agency, so I have 24 years in serving kids in some capacity, either in an independent juvenile court or through the juvenile justice system through the state. A little bit about what we're currently working on right now, and as Joe mentioned earlier, with 242, there's a couple of assessments now that are rolling out, and so we are very busy, hands on the ground, getting those implemented. Just to kind of recap what those are, so you all are all familiar. We have something called the predisposition risk assessment that will be rolling out, and I'm going to tell you all a little bit about each one of these. We have a new needs assessment, our detention assessment, and a structured decision-making tool. And the new thing about this legislation is it also requires that these instruments are validated at least every 5 years, and that's been the kind of the Achilles heel for us, is that we've rolled out some instruments, but we haven't done a good job of following up and validating on our population. We have many stakeholders that have been involved in this process: the Council of Juvenile Court Judges, Juvenile Court prosecutors, public defenders, juvenile court staff, Annie Casey Foundation, the Governor's Office for Children and Families, and the National Council on Crime and Delinquency have been providing some technical assistance for us. The assessments themselves, the first one that we're working on the predisposition risk assessment. This one will be 10 questions, and it's going to measure risk for a kid. And it has some components of what you all may have known about in the past, something called our Comprehensive Risk and Needs Assessment, which we refer to as our CRN. We're very good at DJJ about throwing alphabet soup at you guys, so if I say an acronym, please stop me and I'll be happy to explain it to you. We hope to have this predisposition risk assessment implemented by October 1st. So we have some pretty lofty goals. This is a brand new instrument. The next will be the structured decision-making matrix. A lot of criticism that we've gotten from community as well as judges and other partners is that once a kid gets committed to us, what's going to happen. So this instrument would help to guide those decisions and give them a better idea that if they do commit this kid to the state, or if they make a disposition, what is going to happen with this kid. That too will be October 1st. We have the detention assessment instrument, which you guys have probably heard a lot about. It's been around for a number of years. It's about a 10-year-old instrument, so it needs to be tweaked and revamped and validated. So we're hoping to get started on that pretty soon. And then the last instrument will be the comprehensive needs and risk that we hope will be on the ground in May of 2014. So that's a little bit about what we're working on right now at the Department of Juvenile Justice.
Good afternoon, I'm Sharon Hill. I'm the Deputy Director for Division of Family and Children's Services, also known as DFACS. And I am here with two of my employees, Ursula Davis, who is over our system of care, and Rachel Davidson, who is our judicial liaison. And I brought them because, of course, it takes a village to discuss DFACS. So I've been with DFACS since June of 2005 in various capacities. The Deputy Director since April 1st. But I also, grew up in child welfare services. Started out in child welfare services in my early 20s and worked in a number of capacities from caseworker to adoption specialist, supervisor, and those kinds of things. Also, after that, I was a full-time professor at University of Tennessee at Chattanooga and missed the work. You know, it's one thing to teach about it and talk about it, but it's another thing to be in the practice. So I consider it a privilege to be working with DFACS. We have, you know, a ton of initiatives going on at this time, but some that's relevant to today's discussion I want to mention is our safety response system. And since Joe was doing a survey, let's see, has anybody in the room heard of the new safety response system that DFACS is rolling out? Okay, pretty good. And we rolled out kind of the first part of safety response last year, April 1st, 2012. We went to what we call a differential response model, so that when a report is called into us, you know, either we screen it out because it is not relevant to the work that we do, or we screen it in, and if we choose to screen it in, we either investigate the allegations or we provide family support services. The difference is that both involve allegations of maltreatment. If the child is determined to be, or we feel that the child is not safe in their current situation, we will investigate, and we have 24 hours in which to commence that investigation. If there's an allegation of maltreatment, but the child is safe, then we do family support service, and we have 5 days to begin that. So the family support service is one that I want to, bring some attention to, because it's most appropriate for what we're talking about here. Family support service is designed to provide some in-home services to families that are in need of assistance with day-to-day parenting kinds of things. And what we've seen already, and I know that we will see more of, is juveniles or older youth that we will be receiving referrals on that will probably end up receiving some family support services. So family support service, the family goes through an in-depth assessment, and from that assessment we determine what community-based agency supports are going to be best for that family. So that can range from anything from substance abuse counseling, support groups, just a number of different things. We are looking at already, based on what we've seen thus far, what additional agencies we may need to contract with in order to provide those kinds of services. So family support services out there. The rest of the safety response system will be implemented statewide, particularly the CPS portions, investigations, family support, and some other things by February 1st. We will go on to involve foster care in the safety response system model by the fall. So family support is where we will be doing quite a bit of work around community-based initiatives. A second thing that I want to mention, and I just thought of this because Sarah Best-Hut's in the city right in front of me, that about a year ago, she and I and a number of other internal as well as external stakeholders began a project that we're calling Teens Are For Me. And the goal of that is to really collaborate with all agencies involved in serving older youth. And we started with a focus on older youth who are in care. But as we move into family support services and family preservation services, I think we will be involving a lot more of those youth, and trying to prevent them from entering care. But with Teens Are For Me, we've started to look at ensuring that we had the necessary services to ensure that youth are safe, healthy, educated, employable, and connected. And we did steal that from someplace. But we look at all of those. Right, we sure did. It was part of, with our after-school programs and all of that. But we thought it was fitting for what we wanted to do. Yes, that is what we want for children. So within that, of course, we have community-based, community programs with DFACs that focus on education of our youth that's in care, in particular tutoring, and also after-school services. We have been fortunate to work with Department of Education in getting the access to their longitudinal data system, which our staff are raving about, because for the first time, our DFAC staff are able to go in and take a look at the educational history of children who are in care, so that we can better assess what their needs are and provide that tutoring service. Also, what Diana does not know yet, and she's sitting beside me, is that we have recently targeted an individual member who will be our DJJ liaison, so that we can work more closely with DJJ in the services for our children, as well as those who are in, again, family preservation programs that have not come into care. But we know that a number of issues have come up for us that we're targeting. The law enforcement involvement with youth who are in care has really gone up, and we've been working with our group homes and other congregate care providers, as well as foster parents, about the appropriate time to call the police, because we know that we've had quite a bit of law enforcement activity with our youth who are in care. Also working on the school disciplinary actions. We have a number of children from day to day who are suspended from school, and also expulsions. Expulsions has been really a tremendous kind of issue that we've had to deal with, because what happens is that when a child is expelled from school, generally the placement that they are in will also fall apart. And it's very difficult for us to find another placement for a child who has already been expelled from school. So that's something that we have really targeted to start to work on. We have many other things going on, from Medicaid transition. Children would be transitioned from Medicaid fee-for-service to Medicaid CMO beginning January 1st, 2014. We met with DCH, Department of Community Health, today, as we are in the midst of doing some intensive project management to ensure that that rolls out smoothly by January 1st. We will be doing lots of education with our stakeholders. So our plan is definitely to reach everybody who's dealing with youth who are in care, from the judges to foster parents to various other community groups, about what this Medicaid CMO means. What we are certainly believing is that it's going to improve the medical and behavioral health care of children, who are in foster care. So we have that going on, as well as a few other things that I will give Bob a chance to talk. Thank you.
Thank you. My name's Brad Bryant. My path's been a little bit different than the others. I did 12 years on the DeKalb Board of Education, 7's chair. Did 8 years with the State Board of Education. I've spent the last 2.5 years working within the DOE, and then Monday I had the great opportunity to lead the governor's effort of the REACH scholarship program, which is putting a needs-based scholarship in place to go alongside our Hope Scholarship. But over that course of time, I've had a chance to work within the community, within the school system, and my first observation today would be, and the reason I wanted to go last was, if we'd been sitting here 3 or 4 years ago, everyone, as we've gone down through here, everyone would have been telling the story in isolation and not working with each other. And so I think it's important as you leave out of here that you realize that your state agency actors are working together better than ever before. And if we're going to create better conditions for our children and our youth, that's the only way that it can happen. And we can talk about those individual, and I can give you examples where DOE has worked with each of the providers and each of the individuals that are up here. And things that are of interest to me is you may or may not know that DJJ is a school system, and it's the 181st school system in Georgia. So 15 years ago when I was on the DeKalb board, educational outcomes for children that were in DJJ were not of interest not only to DJJ, but to the school systems that were sending the kids. It was let's send them, let's house them somewhere else, let's not worry about them, and that's how we've gotten to Joe's point about it being high cost for low results. And we've got to change that paradigm as quickly as we can to get the savings that we need to invest in kids, but more importantly, to give these kids an opportunity to be all that they can be. So the first question I'd like to ask y'all is do you consider yourself to be, and this is from Tim Elmore, who does a lot of corporate training for Chick-fil-A, do you consider yourself to be a thermostat or a thermometer? And what I would say in Georgia in particular, and probably around the country, is we've been very good, and all of our agencies and all of y'all have probably been pretty good about being thermometers, measuring outcomes at the end, and doing that very anecdotally, so that it feels hot in the room, but you can't tell what the temperature is, and you don't know what you've got to do to bring the temperature down to comfortable conditions. And so I think all of us have the opportunity to become thermostats with the children that we engage with during the time and space that we've got them within our control or within our opportunity to demonstrate best practices. So some of the things that we're doing in the K-12 school space is that we are trying to redefine what school climate looks like. And I would argue that school climate and community climate are probably going to be one and the same. And Judge Roberts probably would agree with that. But let's just start with the fact that school climate is what we're going to be dealing with. So what we're doing is trying to define that, trying to look and say, what is it that creates a healthy environment for students and teachers and staff and parents to come into a community of learning and do a far better job than the outcomes that we've currently been looking at. Some of the ways we're doing that, and y'all may know this, you may not, is that this past year we received 600,000, so that's 600,000 voluntary and anonymous surveys of school climate from the kids you serve. So 7th grade through 12th grade, we've got data points that are anonymous, so that hopefully they're answered honestly by the kids that are filling them in. It gives us all kinds of points to let us know what that community and what that school climate will be. And we can translate that into information that then we can then pipe to Joe, we can pipe to DJJ, we can pipe to Sharon, we can put in the hands of the judge so that she can pull up a screenshot and determine whether the relative health of the school is good, but more importantly, she can ask the questions of the student and the family that are before her to let her know this is what I need to do to create an intervention. And I'm of the opinion that prevention is the best intervention, but we know that we're not there yet, and it'll be a while before we get there. So we're going to be able to measure through that approach what the school climate is, and we're going to be able to assign to each school a school climate rating on a scale of 1 to 5. So that if you guys are working in a school that's got a 3 with a downward arrow, that probably means you need to figure out how to get more community resources in there to turn it around. If you've got a school that's at 5 in a green light, you probably want to do what you can to help make sure that those individual kids that aren't getting all the services they need are getting that attention, but rather than giving every person, whether they've got a brain tumor or whether they are completely healthy, the same dose of medicine, we're trying to individualize what is going to be the preventative medicine that they need. We're also on the academic side pulling our waiver with US Ed is on the College and Career Ready Index. And what it's going to do is to give you a 0 to 110, I believe, glimpse of what's going on in the school. So you'll be able to learn and see what the academic performance metrics are, and they're on things other than a single standardized test. So it should help you in that way, and we're trying to deliver that to DFACs. We're trying to deliver that because our belief is getting information out to you is ultimately going to be the most transparent way to create the positive outcomes that we're looking at. That will also allow us to start working in more targeted fashion with United Way, with other funders, and I realize that folks love to fund what they love to fund. But if we've got too many resources being delivered into one particular area on that 0 to work pipeline, what we're doing is we're helping that one place, but we're leaving big gaps all along. So if we've got a community that doesn't have any services for their middle grades kids, we need to figure out how to deliver those, and we need to work with the community partners to do that. And hopefully what that will allow us to do is we're pulling together a cross-sectional team from around the state to put in what we believe is one of the best evidence-based practices for intervention in school climate. It's PBIS, Positive Behavioral Intervention and Supports, to come up with a statewide plan with the goal to start reducing out-of-school suspensions, because we know a couple of things. One, we know it has a disparate impact for our minority youth, and particularly our African-American boys. And then the way I would tie that into how that ultimately gets us to the finish line is, my last metric, is that for a cohort of 8th graders, those kids that miss 15 days or more in a school year for whatever reason. So it may be mom and pop taking skiing for 2 weeks, and they're in that cohort of, or if they go 15 days, they're in that cohort of 15 above. The likelihood that they will graduate with their peers 4 years later drops from 81% for a student that misses 0 days to 36% of the kids that miss 15 days. So it's relevant to all of us in the room, because if a student's put out of school for 10 days, there's 10 of the 15 days. So we need to get the information to the judge so that she can pull it up and ask how many days are you missing, and start to figure out how we do that. That also helps us in that we don't send as many kids in the pipeline to DJJ, and we can get back to the community base. So my main points would be we need to be a partner with you and with these agencies. And the second thing is that we're really working hard on trying to get data and information that we can then push out to share with all of the partners that are up here.
Well, I'm not going to use